Hi, I'm Paul Mears, Chief Executive, and I'm just going to give you a quick update from the July board meeting of the Trust. As always, it was a busy meeting, and we began with a patient story, as we always do. And this time the patient story was led by Dr. Catherine Patrick, our new GP Director of Primary Care, who introduced a patient's son who'd come to talk about his experience of supporting his mother in her nursing home, making sure that she had what we call a treatment escalation plan, or TEP. And we're doing a lot of work on this both within the hospital and within primary care locally to try and ensure as many patients as possible have a treatment escalation plan, so that if their situation deteriorates or their health gets worse in their own home or in a nursing home, we know what their wishes are, to make sure that we don't bring people into hospital unnecessarily if they'd rather be treated or cared for in their own home, but also if they come into hospital, whether they want to have treatment or not for certain interventions. It was a really interesting patient story from the son of a lady who, as I said, had been in a nursing home, and Dr. Patrick is leading that work with a number of consultants within the hospital to look at how we can improve our processes. So it was a really helpful patient story to inform us a discussion about how we manage treatment escalation plans in the community. We also had a great presentation around the progress on our Symphony programme. This is our programme of how we're working in a more joined up way with GPs, community services and social care to look at how we can care for our most complex patients in a more effective way, again predominantly outside of hospital, but also looking at how we redesign the way in which primary care locally to us operates to make sure it's sustainable for the future, and making sure that where patients do come into hospital, we're able to get them home as quickly as possible. And the work of our Symphony complex care team was described, how they're supporting discharge planning, making sure that people are coming into hospital are only staying as short a time as they need to. And it was a really good opportunity to have an update on Symphony, which has now really started to have an impact in the way we use beds in the hospital, reducing our length of stay, reducing unnecessary admissions. So great progress that's been made over the past couple of years. We also talked through our performance, and our operational performance is again really positive, both in terms of our delivery against the 4-hour A&E standard, our waiting time performance, our cancer performance and our diagnostic standards. So it was a really great scorecard of green that we're able to review as operational performance. And for the first time, we've also now reviewing in our performance reports a safety scorecard for maternity. There's a lot of data being collected in maternity around patient safety, and we were able to review that for the first time in its comprehensive way at the board. And there were lots of questions from our non-executive directors about what we're doing, the work we're doing to improve maternity safety, which is being led by Helen Williams, our head of midwifery. We had also had a presentation, a timely presentation from Adrian Pickles, who is our Fire Health and Safety Manager, about how this Trust is taking steps to make sure that our fire safety is as good as it could be. You'll appreciate, in light of the recent tragic events at Grenfell Tower, there's a lot of focus on fire safety in public sector organisations, and we've been doing a lot of work over the past couple of years to improve both our fire safety infrastructure, our fire alarm systems, our compartmenting above the ceilings, making sure that we're as good as we can be, but also making sure that staff are trained on how to manage should we ever have any fire situations within the organisation. So it was a really good opportunity to have an update from Adrian on the great work that's being undertaken there. As always, we talk about finance at the board, and we were able to review our financial position for the first quarter of the year. We're broadly on track with our plans, which is really positive, but we also talked about the challenge we face as an organisation going forward, the need for us to deliver our savings plan for the year, and there's a lot of work going on across the organisation to do that, so it was good to be able to brief the board on that as well. So lots of great work being discussed, lots of topics to talk about, and again a wide-ranging discussion and challenge within the board meeting. Hopefully that gives you a good overview of the key points we talked about, but as always, if you've got any questions or anything you'd like further information on, please drop me a line and I'll be happy to provide it. Otherwise, I look forward to giving you an update from the August board. Thanks a lot.